Good evening, my name is Julia Powell, Chief Executive Officer for Community Pharmacy Surrey and Sussex. Also with me here tonight is Sandra Lamont, Communications and Engagement Lead, and Mickey Kassar, Business Administrator from CPCS. Before we start tonight's webinar, I will just go through some general housekeeping. This webinar is being recorded tonight so it can be made available for those pharmacy contractors unable to attend the event. As there is a large number of people on this call, could everyone go on mute with their cameras off to minimise background noise and distraction? Thank you. For this webinar, I will be in presenter mode, so I will not be able to see the hands up or chat function. There will be time at the end of the presentation for any questions that you have. So please type any questions into the chat box as we go through tonight's webinar. All questions from tonight and tomorrow's webinar will be added to the CPCS website, together with a recording of the webinar and the slides for your future reference. So this evening, we will take a brief look at the GP CPCS service from the pharmacy and the surgery viewpoints. I will then update on the progress to date across the 3 integrated care systems in Surrey and Sussex, namely Surrey Heartlands, Frimley and Sussex Health and Care Partnership. I will then move on to how to claim for the set-up payment for GP CPCS before taking questions at the end of the presentation. So what is the GP CPCS service? NHS CPCS launched on the 29th of October 2019 to progress the integration of community pharmacy into local NHS urgent care services, providing more convenient treatment closer to people's homes. Following successful pilots, the service was extended from the 1st of November 2020 to include referrals for minor illness conditions from general practice, as well as from NHS 111. As part of the GP referral service, there is no provision for the supply of urgently required prescription medication. The service aims to make it easier for patients to access quick and convenient consultations with the right healthcare professional in a way that is safe and effective. Also, to increase patient awareness of the role of community pharmacy as the first port of call for minor illnesses and medicines advice, and to support the integration of community pharmacy into the PCN team. 94% of pharmacies are already signed up to CPCS. If you are signed up, you do not need to re-sign for the GP CPCS service. If you are not signed up to provide CPCS, you can still sign up through MYS to offer the combined NHS 111 and GP CPCS service if you want to. The launch of the GP CPCS service has been a soft launch with phased implementation by NHS England. In the South East, the integrated care systems lead on the implementation process with some support provided by NHS England. This service formalises the care navigation processes put in place over the last few years, whereby GP practices were signposting patients to community pharmacy, and the new service improves the governance around this referral process. So 5 regions piloted the referral pathway, and this was across 19 CCGs and 47 PCNs. Unfortunately, there were no pilot sites in the South East, which meant we had to start the implementation process from the beginning. As part of the pilots, 9,551 referrals were made by GP practices, with 88% of the referrals completed by the pharmacies. Only 1 in 10 patients were referred back to the GP surgery or another service for further support. In one of the pilot sites, Darwin and Blackburn, the practice manager has recently stated that since the start of the pilot, 135 clinics have been saved across 3 GP practices, and referrals are now averaging, for each community pharmacy, 22 per month. 97% of patients have said that they would use this service again. So the referral journey for GP CPCS has the following stages. The patient contacts the GP surgery for a minor illness which is suitable for GP CPCS. Using the usual triage process or care navigation within the surgery, the patient is informed that referral to a community pharmacy is appropriate for them. The patient consents to the referral and confirms which pharmacy they want to be referred to. The patient is informed that the pharmacy will contact them within the agreed timescales, as has been agreed between the pharmacy and the PCN. The patient is given the pharmacy's contact details. The surgery then sends an electronic referral message to the patient's chosen pharmacy. This will be via the agreed referral pathway and may be via NHS Mail, a standalone system such as PharmRefer, or an integrated system such as EMIS Web. The pharmacy will check their system for referrals on a regular basis throughout the day. On receipt of a referral, the pharmacist will then either contact the patient by phone to carry out the consultation, arrange for them to attend the pharmacy if appropriate, or where they have the capability, offer a video consultation. Where the patient's symptoms suggest something more serious, the pharmacist will help the patient to arrange an urgent GP appointment via an agreed escalation pathway, or escalate to an urgent care setting if needed. The pharmacist will make a record of the outcome and send a post-event message back to the patient's GP by secure digital messaging. This closes the loop and improves governance. The payment to the pharmacy contractor for providing the service is £14 per consultation. So potential outcomes from the consultation are shown on this slide. The pharmacist should use their clinical judgment to decide the urgency route and need for onward referral if they determine the patient requires different care, for example, back to their GP for a same-day or non-urgent appointment or to an urgent care setting. The endpoints of the consultation are the same as for the NHS 111 service, so this may be advice only or advice in the sale of a product. It may also include advice and referral into a locally commissioned NHS service, such as stop smoking or sexual health services, or to another service, for example, physiotherapy. It may also include advice and referral back to the patient's GP or to an urgent care setting. The conditions that can be referred are shown on the screen. These are based on the current NHS 111 service. So what are the benefits of the GP CPCS service? The benefits of the service improve patient access to a health professional. Referring patients to community pharmacy for minor illness will free up GP capacity to deal with patients with more complex needs. It is estimated that 6% of patient GP appointments can be dealt with by community pharmacy. So around 20 million GP appointments a year could be saved. Pharmacists are already used to running the service from NHS 111, and the GP element will encourage greater collaborative working between the GP practice and community pharmacy, and formalise and reimburse the process where referrals are already taking place. Patient satisfaction from the pilot was very high, with 97% of patients stating they would use the service again, and 86% of patients happy to be referred to a community pharmacy when first triaged by the surgery team. So in implementing GP CPCS, there are a number of principles agreed to support the implementation of the project. With the integrated care system, we are looking to ensure that locally the surgeries in a PCN all look to go live with GP CPCS. This may mean in a phased approach with one surgery going live first, followed by the others. But what we didn't want was individual practices going live independently of the others in the PCN. There are a number of processes in the GP CPCS service which we are trying to ensure are consistent across the ICS. This includes the minor illness conditions being referred and the use of the same GP referral pathway into community pharmacy using the same IT process to create and send the referral. The back office phone number will be the approach for escalating patients back to the GP practice, and the post-event messages from the community pharmacy will have a consistent format. This will be important to ensure a smooth process for community pharmacies, and for them to not have to deal with different processes with each surgery they deal with. Please note, however, if you are on a border of a number of different integrated care systems, you may find slightly different referral processes coming from the different integrated care systems. So we are now going to look at the implementation process and where we are currently at. In terms of PCNs linking in with community pharmacies, we are lucky that this is being led via the integrated care systems. We have working groups set up across all 3 integrated care systems, and they are meeting on a regular basis. We have identified key stakeholders and discussed the clinical, operational and governance elements of GP CPCS. We have proposals for the referral system, which we will look at in more detail on the next slide. Following agreement on the referral system, the practice training and go-live process can then be implemented. So this slide of the electronic referral processes is very detailed, and I'm just going to talk through the top line options. This stage of the process takes the longest, and it is important to get buy-in from the GP surgeries on the decisions made. If they don't agree on the referral pathway, there will be little buy-in and movement on delivering the service in an efficient and sustainable manner. Listed are NHS Mail and integrated systems. The NHS Mail system uses a Word document referral template. When a patient requests an appointment, the template is opened, the patient details populated, and it is then sent as an attachment via NHS Mail to the community pharmacy. When the community pharmacist is doing the consultation, they open the attachment and transfer the patient details onto Farm Outcomes. They complete Farm Outcomes and the post-event message goes back to the referring GP practice. The EMIS integrated solution is linked to the EMIS system and enables patient data to be pre-populated to the referrals and sent directly to Farm Outcomes. The information comes into the pharmacy in the same way as referrals from NHS 111. This is an efficient way for both GP practice and pharmacy teams, but does incur a licence cost. You will see more on this system later. The electronic referral processes listed here are the options that are available at the moment. However, in the future, IT systems will develop further, and this may lead to changes within the referral process. For example, this could utilise the use of online consulting platforms such as Footfall to redirect patients. And in the longer term, over 18 months to 2 years away, the GP IT Futures programme, NHSX, and the Pharmacy Project is looking to offer a free and seamless transfer of data across the systems, which would make referrals simpler and easier. So following the completion of the consultation, the following post-event messages will be sent back to the GP surgery. This slide shows the template form, and this slide shows the post-event message from Farm Outcomes. The Farm Outcomes message will currently go back to the surgery as an email. However, shortly, the messages will go via MESH, which is the Message Exchange for Social Care and Health. This will then go directly into the surgery's EMIS workflow, which is beneficial for streamlining the process for the surgery. Whereas referral pathways will hopefully all be agreed at an ICS level, some elements of the service will be agreed at a PCN surgery level. This will include the cut-off times for the pharmacy referring back into surgeries for same-day consultations. It would also include the names of people for escalation of issues and the back-office telephone numbers for urgent referrals. These details will be collected and shared with the pharmacies as surgeries go live. Any surgery without a back-office number, we will be discussing alternative route as the practice goes live. So where are we currently at in Surrey and Sussex with our GP CPCS? So we are very fortunate in Surrey and Sussex that the ICS have taken system ownership of the GP CPCS service. Across all 3 integrated care systems, we have working groups set up consisting of senior personnel who meet regularly. Expressions of interest have gone out to all PCNs, with a number of PCNs wanting to become pilot sites and early adopters of the service. The referral pathways are at varying stages of agreement, which we will go through shortly. The escalation pathway back to practice will be via the practice back office number. And the next steps are to finalise all governance arrangements and processes before communicating with affected pharmacies the go-live dates and finalising training at practice level. Due to the number of practices across an ICS, this will be an extensive rollout, which will take some time. I'm now going to look at each of the 3 integrated care systems individually. So first of all, looking at Surrey Heartlands. So within Surrey Heartlands, we have a working group set up for GP CPCS, which includes the Interim Director of Pharmacy and Medicines Optimisation, as well as digital leads and support from NHS England. On the 24th of March, we presented at an LMC webinar to over 80 participants the various options that were available for the GP referral pathway. There was then a voting process that took place as to which was the preferred option for referral from surgery into the community pharmacy. The preferred choice was the EMIS Pharm Outcomes option. So this then continued, and a webinar was run on this option on the 14th of April for those PCNs which wish to become pilot sites. The referral system of choice at the moment is the EMIS option, and the financing for this system has been agreed, and we are just waiting for this to be completed and signed off. We are expecting the first PCN pilot site to start the GP CPCS service in May, and then following the quick learns and any training issues from the pilot site, this will then be rolled out to a further 10 PCNs before the remaining PCNs are then onboarded. This slide demonstrates the different EMIS screenshots that are available, and you'll see that there is a video link there to a YouTube video in which it'll show you in a 4-minute video the process of using the EMIS system to signpost patients through to the Pharm Outcomes system for community pharmacy, and it will take you through what a referral process would look like. I would recommend, if you're in the Surrey and you're likely to be using the EMIS system, to watch this YouTube video. So looking now at the Frimley integrated care system. So we have a working group set up, and we are meeting every 4 weeks as part of that group. Expressions of interest have already been received from the PCNs, and we have 4 pilot sites that are looking to go live first. The referral pathway for Frimley is likely to be a referral template, such as the Ardens template, which will then be sent via NHS email to the community pharmacy. Within Sussex Health and Care Partnership, we are now meeting every fortnight as a GP CPCS working group, and just last week a new support manager has been put in place to support the implementation of this project. Expressions of interest have all gone out to the PCNs, and they are due back by the end of this week, so we will then know which sites are looking to go as pilots and early adopters of the service. The decision on the referral pathway hasn't been completed yet, and the main issue that they have in Sussex is that, unlike Surrey, not all practices use EMIS, so it is likely to be a referral template via NHS Mail. I'm now going to look at the next section, which is around the engagement and setup payment. So the initial setup payment for GP CPCS of £300 can be claimed up to the 5th of July. To enable you to claim this payment and to have the required evidence and documentation you need for it, there is the Annex F form, which is in the service toolkit available from the PSNC website, which will take you through what you need to complete. The claim for the £300 is made via MYS. As part of it, all contractors are asked to attend one of these webinars to ensure that they meet the discussion element of the Annex F requirement. As stated, not everybody will be able to attend these webinars, so a recording of this will be available on the website. So looking at the Annex F in detail, the first requirement of the 5 parts is that the contractor has participated in discussions with a delivery partner or LPC to explore how they might promote uptake of CPCS locally. And obviously this would include an early explanation of the options and discussing some of the planning around the rollout. So tonight's webinar has provided you with this. We have given you an overview of where each of the integrated care systems are at currently, although obviously these will be subject to change as future work moves on. The slides and a recording of this webinar will be available on our LPC website next week. One of the questions that is frequently asked is, should pharmacies be discussing GP CPCS with their practices? Although it's not a requirement, if the opportunity arises, then yes, it would be fine to have that discussion. However, one of the things that we ask to bear in mind is that we are trying not to have a specific arrangement between one practice and one pharmacy, excluding others. We are looking for an entire PCN to be going live at the same time. But if you do have any expressions of interest, then please pass those on to us at the LPC so that we can ensure that those expressions are included in the planning for the rollout of the service. So moving on to part B of the Annex F, the contractor has participated in meetings which may be web-based. And obviously that is to brief pharmacies and GP practices on the referral pathway. So tonight for now covers this off. We have discussed the agreed pathways and potentially NHS Mail for Sussex and Frimley, or the integrated EMIS for Surrey as our chosen referral pathways. We're looking to use farm outcomes for data capture and feedback, and any surgery referrals will be using the back office phone number. These may be subject to change as your area goes live, but this initial agreement is enough for Annex F. Presentation will be on the CPCS website, which will act as a briefing for anyone not attending. And our website and newsletters and emails will be used as updates for when the as progress is made and this rolls out across your locality. So a lot of these sections do repeat each other. So again, section C is that the relevant members of your team have been briefed on this service and understand what is happening locally. So you can use the slides and recording of this webinar, which will be available on the CPCS website, to brief your teams. Also, on the PSNC website, under the GP CPCS service, there is a document, the GP referral pathway to the CPCS. This is an action plan template for your pharmacy teams to ensure that you have completed all of the actions required prior to going live with GP CPCS. The fourth option is actually to create an action plan for implementing the new referral pathway in your pharmacy, and also ensuring that your SOP is updated to include the GP referral pathway as well as the NHS 111 pathway. So following tonight, you should create a pharmacy-specific action plan. You can utilise the template available on the PSNC website, and ensure as well that you have updated your SOP before you implement this service. The final section on Annex F is to ensure that all relevant members of the pharmacy team are fully briefed. Again, you can utilise the slides and recording of this webinar on the CPCS website to brief your teams. Keep a record of which staff have been briefed and complete the action plan template for pharmacy teams on the PSNC website, or if you're a multiple company, the relative forms from your own company. The service specification and toolkit are all available both on the PSNC website and the NHS BSA website. The PSNC website has a number of useful resources to enable you to implement this service. So what are the next steps? So PSNC has all of the relevant tools and resources on their website. So this includes the Service Specification Toolkit and Action Plan. So complete the requirements of Annex F by the 30th of June and claim your engagement and setup payment by the 5th of July. The engagement claim for the £300 setup is via NYS. Ensure that you've read the service specification and toolkit, and if you are not already providing CPCS for NHS 111, sign up to the service via NYS. So in summary, your LPCs are working hard on progressing GP CPCS within the ICS areas. However, widespread coverage will take time, particularly where there is still a focus on COVID vaccinations. GP practice buy-in is essential to operate an efficient and sustainable service, which is why sometimes it is taking longer to move forward in terms of timescales than we would like. We will be in touch with individual pharmacies as your local surgeries go live, and keeping you up to date via our newsletters, emails and website pages. So I'm now going to go through any questions which anybody has as part of this presentation.